San Francisco Mayor Daniel Lurie and his Department of Public Health has told the people of San Francisco that they will be closing 3 healthcare centers for youth, immigrants, and seniors. The Southeast Mission Geriatric Clinic, which offers wraparound care for seniors, including mental health care for many immigrants who endured trauma and witnessed atrocities in their home countries, face closure. There is no other replacement in San Francisco, in a city with a large number of billionaires.
My name is Francisca Oropeza, and I'm a behavioral health clinician for older adults here at Southeast Mission Geriatric Services.
And how long has this center been here?
The center has been here since the late 60s, early 1970s. It was founded because there was a need to serve older adults who were showing up more and more in the emergency room. People were dying, and so this was established by Joe Ruffin and by Severino Artates to prevent those deaths and to serve older adults with mental health concerns.
And we're having more and more seniors in San Francisco. It seems like this would be a vital institution for community and for people who need help.
It is a vital institution. It's the last. There were multiple older adult mental health clinics in San Francisco. Our sister city, CCOA, was closed in July 2024, and those patients were partially moved here and other places. We're in fact in the southeastern part of the city, but we service the entire city. I have patients that are in the business district, out by the southeastern part of the city, in the Bayview. We serve low-income people who are over 60 with mental health concerns, from moderate to severe mental illness, and a lot of them are isolated by themselves. We are a place to come to feel safe, to receive mental health services, psychiatric support, and connect them to other service providers so that they don't die by themselves at home, so that they're not so isolated. And we've connected a number of people actually to IHSS and other services that are vital for their mental health.
And during COVID, a lot of people suffered.
Absolutely. A lot of people during COVID suffered from isolation. We tried to keep them connected. I actually took a couple of patients to their COVID vaccines, and that was an important job that not a lot of people were doing for older adults. We had people going to different facilities to make sure they were vaccinated. Our older adults in general were very willing to get vaccinated, and so I helped to do that. I was here every single day during the pandemic. This clinic was never closed because there was no social worker here. So I made sure that social workers at least were here to serve patients if they called with a crisis. And we service over 150 patients right now.
This could be a life and death question for people.
This is a life and death question for many, many patients who are by themselves. They easily get isolated. We have groups here to keep people connected. A lot of times people have family, friends, but when depression hits, anxiety, or they burn too many bridges if they have bipolar, schizophrenia over the years. So we try to keep them connected and alive. We don't want people to die by themselves.
San Francisco has one of the wealthiest groups of people in the world, over 80 billionaires. I mean, how do you feel? I mean, like, with all this wealth, we can't even keep this kind of center open, which is vital for seniors.
Yes, San Francisco is one of the richest cities in the world. We get tourism galore. Even during the pandemic, we had tourism. So it's disgusting to me that we can't serve our patients, our older adults, who will be probably a third of the population by 2030, 2040. It's a third of the population in San Francisco, and we are a rich city. These cuts are a choice. Not serving older adults is a choice. It is not something that has to be done.
So what's your message to Mayor Lurie and the Board of Supervisors?
Mayor Lurie, stop cutting services for older adults. We need these services for our older adults saved. Keep them in the Mission. We are in the Mission, easily accessible by train, bus, taxi out here. There's no need to close us. There is no need to close us when we are only $7,000 a month in rent, and we service a dying population that deserves services, that have been San Francisco natives for many, many years, that are housed in San Francisco, that actually would really vote for you if you continue to give us services. Do not close our clinic. We service the entire city of San Francisco. We need your support. Don't do this to elder adults. Don't let people die alone at home.
And they will die if they don't get the services. That's what you're saying?
Absolutely. Absolutely. I reach out to people every single day. I have for almost a quarter of a century. That has been my mission, to keep services for older adults alive, because every few years someone wants to close this clinic. And now this is the last one. And we service the whole city. If you're poor and you're mentally ill, low income, we are here for you, and we will fight for services here in the Mission. And you know, this is a revenue generating clinic. We get Medicare, Medi-Cal services. And so this is
so you're getting funded, actually.
We are generating revenue for the city. So to eliminate positions that service older adults where you're getting money, it doesn't make sense. It doesn't make sense to anyone.